Thank you for joining us for another Boston Indicators video briefing. My name is Ann Califf, and I'm excited to share with you findings from a report that we released last fall with SkillWorks entitled Care Work in Massachusetts, a Call for Racial and Economic Justice for a Neglected Sector. Care work has forever been critical to the health and functioning of our society. However, as we detailed in our report last fall, long histories of racial prejudice and gender discrimination have led to the systematic undervaluing of these jobs. Poor working conditions for care workers has immediate consequences, not just for the quality of care that clients receive or even the immediate economic security for care workers themselves, but also the ability of care workers to accumulate wealth over their lifetimes and save for themselves and for their families. For this video briefing, I'll be presenting key findings from that September 2022 report, as well as tying in some references to our new Racial Wealth Equity Resource Center. My presentation is divided into 5 key parts that loosely follow the report itself. First, we'll look at a brief history of care work, focusing specifically on the intersection between care work and race. Then we'll look at projected demand for care work in Massachusetts, followed by a demographic profile of paid care workers, looking at the job quality for care workers in the state, and finally we'll end with some concluding policy thoughts. The racial division of care work can be traced back to slavery. Before the Industrial Revolution, women were obligated by their position as mother, daughter, sister, or wife to care for their family and kin in the home. However, the context in which this labor occurred varied greatly by race and class. In the American South, for example, enslaved Black women were forced into domestic and care roles that were physically taxing, placed them at high risk of abuse, and denied them the ability to care for their own family. Unfortunately, this pattern continued after emancipation into Reconstruction and the Jim Crow era, as many Black women were coerced back into care roles through exploitative labor agreements and other channels. In the North and in the Midwest, Black women were shut out of higher paid, less physically demanding jobs that were available to white women, such as clerical work or work in retail establishments. And instead, they were concentrated in paid care work, and in particular, in the hardest tasks associated with care work, such as cleaning floors or performing nursing tasks. Meanwhile, in the West and in the Southwest, Asian, Mexican, and Indigenous women were channeled into domestic labor, such as working in commercial laundries or as maids. In the late 19th century, we saw more care work move out of the home as medicine became increasingly professionalized and technology evolved. The number of hospitals proliferated and more care facilities emerged. And with that came new support roles in these facilities. However, the gender and racial divisions continued. Care jobs were still disproportionately performed by women, and women of color were still concentrated in the most physically demanding tasks, working as nursing aides or licensed practical nurses, for example. In the early 20th century, we saw some important labor reforms, but unfortunately, they excluded all care workers. Domestic workers were left out of the National Labor Relations Act, for example, that asserted the right to unionize, and they were excluded from the Fair Labor Standards Act that set a federal minimum wage. It wasn't until 2015 that all federal protections were extended to include care workers. And finally, fast forwarding to where we are today, technological advances and improved medical treatment and care have led to people living longer lives, and with that, greater demand for care work. Many care sectors now rely heavily on immigrant labor. In 2020, one study found, for example, that 1/5 of child care workers and roughly 1/3 of home health care workers were born outside of the United States. Limited immigration pathways for care workers leaves many vulnerable to exploitation. As demographics continue to shift in the next 20 years, demand for care work is expected to increase. In Greater Boston, the number of retirees is expected to grow by 50% from 2020 to 2040, from approximately 690,000 to a little over 1 million. Nationally, the number of folks aged 85 years or older is expected to triple between 2020 and 2060. And this number is of particular importance because these are the folks most likely to require care. What this means is that while all jobs in Massachusetts are expected to grow by 3% between 2018 and 2028, we expect the demand for care jobs to increase by 12.5% in that same period, which is, roughly 4 times that of the rate for all jobs. Now, before jumping into the demographics of care workers, I'd like to just quickly pause and define what I mean by care workers. For the purpose of this report, we focus specifically on home care workers, workers in long-term care facilities, such as certified nursing assistants working in an elder care facility, and we focus on child care workers. We know that the regulatory environment surrounding these 3 is quite different. However, we chose to include all 3 because they provide critical supports that we'll all require at some point in our lives and really work to enhance an individual's personal capacity or ability, either early in life or later in it. When looking at a demographic profile of paid care workers, we found that care workers are still overwhelmingly women. While women account for about 50% of the overall labor force in Massachusetts, they accounted for roughly 90% of the 3 fields that we looked closely at. This might not seem too shocking, but to put it in perspective, about 19% of active duty enlisted service members are women, which means that women are twice as likely to serve in the military as men are to be a care worker. Women of color, and Black women in particular, are still disproportionately represented in these lower wage fields that we profiled in our report. What you'll see here is that about 11% of workers in the state are Latino, compared to about 27% of home care workers. Black workers account for roughly 7% of all workers in the state, but 43% of long-term care facility workers. So that's roughly 6 times the representation in the overall labor market. Care workers are also more likely to be foreign-born, as you'll see in this next slide. While about 1/5 of workers in Massachusetts were born outside of the United States, just about 1/4 of child care workers were, 1/3 of home care workers, and almost 50% of long-term care facility workers. Next, we'll look quickly at a whole host of job quality measures to see how we're treating workers in these fields. The first and the most obvious are wages. And I just want to quickly flag that we use 2016 to 2020 American Community Survey data for this slide, which means that there is a bit of a lag. So we know prevailing wages are higher, but we found this data source to be useful in comparing wages across different fields and occupations. And when we did so, we found that care worker wages were about half that of wages for all workers in the state. Additionally, care workers are less likely to receive employer-provided benefits such as health insurance. While about 75% of workers in Massachusetts receive their health insurance through the state, only about 1/3 of home care workers do, and about half of long-term care facility workers and child care workers. What this means is that care workers are more likely to rely on Medicaid or Mass Health in Massachusetts. While just about 14% of workers in the state receive Mass Health for their health insurance, about 1/4 of child care workers do, 1/3 of long-term care facility workers, and almost half of home care workers. Additionally, care workers are less likely to receive retirement benefits, which has important implications for their ability to accumulate wealth that they could eventually pass on to their families. They face high rates of emotional and psychosocial strain. We know that care workers aren't just responsible for the physical livelihood of their clients, but also their clients' emotional well-being, and often the emotional well-being of their clients' families as well. Care workers face difficult work schedules with just-in-time scheduling, short rest breaks, or long shifts. And finally, the jobs are just dangerous. Care workers face high rates of occupational hazards and injury. So, for example, in 2019, nursing assistants had among the highest overall incidence rates for occupational injury and illness that required time away from work, at a rate even higher than that of heavy tractor and trailer truck drivers. Ultimately, the strain of care work is reflected in its annual turnover rates, measured at over 30% in childcare in one study, and as high as 128% in a different study of nursing homes. Most of one's wealth ultimately comes from the accumulation of one's income, savings, and investments that you earn over the course of your working life. And so the fact that women and women of color in particular are disproportionately concentrated in these care jobs with low pay and worse benefits can be seen as one contributing factor to the overall racial disparities that we see today. To conclude, I want to share with you an imperfect list of some promising lanes for action. Boston Indicators does not necessarily endorse each of these items, but we wanted to share them as some promising lanes for action. One thing that we could do is to continue to strengthen the state minimum wage. The state minimum wage is currently $15 per hour, but we know that that is not commensurate with the high cost of living in the state. We should require employers to pay their employees more, but at the end of the day, a lot of this will require the public sector to better support these industries. And one way that we can do that is by increasing Medicaid reimbursement rates for home and community-based services, as well as long-term care facilities. The state can additionally take steps to ensure that any additional funds are used to directly support workers through increased wages. Currently, home care agencies are not required to register or receive a license to operate within Massachusetts. And without that, the state has very limited options to ensure high job quality for care workers and high quality of care for consumers who are not on Mass Health. We could improve access to training and career ladder programs that we know improve worker job satisfaction and can increase worker retention. I didn't touch on this in this presentation, but in the report, we have a section looking at unpaid care work in Massachusetts, which is ultimately similarly undervalued. One thing we could do to better support unpaid caregivers is to expand the earned income tax credit to include individuals such as a parent who's taking a step back from work to care for a young child or an aging parent. We could pass legislation to increase access to early education and childcare. There are bills currently in the legislative session that would, for example, increase childcare subsidies and provide a new operational funding to help raise educator pay. We could pass labor reforms that make it easier for workers to exercise collective bargaining power, pursuing models such as sectoral bargaining that are more common in European countries. And finally, we could improve public transit and expand affordable housing opportunities. The high cost of living in Massachusetts impacts everyone in the state, but is particularly hard on low-wage workers, such as those that we profiled in the report. Really, anything we can do to improve the quality of public transit and increase access to affordable housing opportunities could really move the needle on care worker livelihood and help care workers both achieve greater economic security today and save in the long term. So thank you again for joining us for another Boston Indicators video briefing, and please check out the full report on the Racial Wealth Equity Resource Center.